and get started. Welcome, everyone. I'm Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. We appreciate you being here today to hear from three Montana physicians who are three of the over 250 medical professionals across Montana who have signed a letter endorsing CI 128. Before we begin, I want to state that these physicians are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers or other affiliated organizations. So we please ask that you respectfully refer to them in any coverage only as they introduce themselves on this call. So thank you in advance for that. Without further ado, I will introduce our first speaker, Dr. Downey.
Good afternoon, and thank you so much for joining us today. I'm Dr. Carrie Downey. I practice family medicine at the Community Health Center in Butte, Montana, and I'm one of over 250 medical professionals across Montana who have signed a letter endorsing CI 28, which is the ballot initiative that will keep government out of our private medical decisions. Across every corner of our vast and very diverse state, medical professionals are proud to support CI 128 to protect our rights and keep the power to make medical decisions in the hands of Montanans and not the government. I'm a family physician. Like many of my fellow medical professionals, I have the privilege of knowing my patients well, in many cases over many years. A big part of that work is to understand their concerns, their fears, and their hopes. It is in this context that I work with my patients to improve their health and overall lives. It is an honor to be a part of my patients' lives in this way, and I see how thoughtfully they weigh each healthcare decision they make. I trust my patients to make highly personal medical decisions for themselves. I also work to keep their health information private. Decisions around health care are personal and should be private, especially those around pregnancy. Doctors and patients alike know that decisions around pregnancy and abortion are among the most personal anyone can make. There are many reasons patients may need to consider abortion. Perhaps they're a victim of rape or incest. Maybe their pregnancy threatened their life. Maybe their birth control simply failed. No matter what we might choose to do in these situations, if it were a patient, our friend, or our family member, we would want them to have the freedom to make that decision for themselves and not have it made by the government. That's what CI 128 is about. It's about protecting the privacy and freedoms of our patients and all Montanans to make the choices that are right for them and for their families. Providing patients with quality, evidence-based medicine is our priority. It is also important to consider the overarching impact of laws that restrict access to care. Following the Dobbs decision and the fall of Roe, individual states have been tasked with deciding on healthcare access for our fellow citizens. Post-Roe data shows that states with policies that are restrictive to reproductive rights have poor health outcomes and negatively influence providers when considering where to work, which means colleagues in all specialties, OBGYN to emergency medicine, to family medicine, to pediatrics, will look elsewhere for careers. Over a decade ago, when I was an undergraduate at Montana State University, I helped compile a report on the healthcare crisis facing Montanans due to a lack of providers, which really had a strong influence on the path that I've chosen to take. This shortage of healthcare professionals remains today. I feel this every day in my practice. Montanans feel this every day in an inability to access care, and Montanans deserve better. They deserve access to the highest quality of care, and we need to be doing everything we can to recruit and retain highly qualified medical providers. Doctors and medical professionals know there isn't room for politicians in our exam rooms. That's why over 250 of us across Montana are supporting CI 128. CI 128 doesn't change access to reproductive care in Montana, but protects it by enshrining it into our Constitution and preventing the ripple effect from policing healthcare. We urge our patients, our neighbors, and all Montanans to vote yes on CI 128 to protect our freedom and right to make personal medical decisions. And I would now like to introduce Dr. Guggen.
There, I think I'm unmuted. Thanks, Dr. Downey. I'm also pleased to be part of this group today and of the 250 plus medical professionals who have indicated their support for CI 128. I've been a physician for over 60 years, and the last 40 of those years, well, actually 41, here in Montana, and I'm now retired. I had specialty training in both pediatrics and in neurology, and my practice was treating children with brain and related disorders. I was the only such specialist of this type in the state at the time, and I saw children and their families from virtually every little town in Montana. I know that Montana families are strong, they're smart, and they want to have the freedom to make their own medical decisions. 25 years ago, I was in the Montana legislature, and I can say with certainty that neither I nor any other legislator have the right or even the ability to make women's personal health decisions for them. Politicians sitting in the Capitol have no knowledge about how complex and how confusing pregnancy complications can sometimes be. In the 1970s, sort of ancient history for most of you, but in the 1970s, ultrasound tests became available. And these tests help women and their physicians maintain the healthiest possible pregnancy outcomes. There were some occasions when an ultrasound indicated a major brain abnormality, and I was asked to meet with the parents to offer my knowledge about what the test showed. Sometimes the abnormality would be a fatal condition, such as anencephaly. These are just heart-wrenching situations. And it's women, their families, their faith healers, their healthcare teams who must make these hard decisions about what to do. It is certainly not politicians. So, in my opinion, it's very important to vote yes on 128 so that Montana women and my children and my grandchildren who live here in Montana have the freedom to make their own decisions about personal health care, including abortion. I'll turn it over to Dr. Taylor at this point.
Thank you so much, Dr. Guggenheim and Dr. Downey. I get really emotional thinking about this because of how personal it is to me. I'm a family medicine physician. I've been practicing in Montana for 4 years now at the beginning of my practice. I see pregnant patients every day. I deliver babies at the local hospital. I'm so thrilled to be a part of such an important piece of people's lives in their sacred journey to parenthood. I'm also a husband and a father living in Montana. More than 250 medical professionals are speaking out in favor of CI 128 loud and clear. The need for CI 128 couldn't be more urgent, couldn't be greater. And that's because abortion's under attack. All across the country, we see attacks on reproductive rights, on abortion access, and we've seen it already here in Montana. Montana has a long, proud history of being different. We buck national trends. We take care of our neighbors. We take care of ourselves. But Montana politicians are starting to look just like every other politician we see across the state, across the country, where they're trying to take away our constitutional rights. In other states, politicians are way too comfortable interfering in patient and private medical decisions. They're power hungry. They're trying to restrict and ban abortion. In some cases, we've already seen tragic, devastating effects of these laws. In 2022, a mother in Georgia died because of archaic abortion bans. Her name was Amber Nicole Thurman. Delays in her care led to her untimely death, leaving her children motherless. In Idaho, we see rural hospitals, critical access points for much of the population of Montana. We see in our neighbor Idaho, these abortion bans are causing the shutdown of labor and delivery units because providers refuse to stay in a state where government oversteps their role and interferes in life-saving patient care. OBs and maternal fetal medicine specialists are leaving in droves to other states where abortion is protected and they can provide the care that their patients need, and they don't have to question whether or not the government is going to come after them for providing life-saving care. We can't let that happen here in Montana. That's why doctors and other medical professionals just like us are speaking out to protect our reproductive rights and encouraging people to please vote yes on CI 128. Extreme politicians have made it their mission to take away our rights. We have to make it our mission to take them back. In the 2023 Montana legislative session alone, extremist politicians introduced over a dozen anti-abortion bills. They've even tried to block this initiative from coming to the people. Since reproductive rights filed CI 128 last year, politicians in Montana have tried every trick in the book to delay, to obstruct, to mislead, and ultimately block this amendment. They've thrown the kitchen sink at it to try to silence the voices of Montana voters. We know that anti-abortion extremists won't stop until they've banned abortion completely. It's our job to stop them. It's up to us to protect our right to make personal decisions about pregnancy and abortion. As Dr. Downey mentioned, choices around pregnancy are so personal and so sacred. I get to see that in my role as a family physician taking care of OB. It's one of the greatest privileges of my career to be in the room with these patients. And we go over all of these different factors to try to determine what's the best and safest route for their life and their pregnancy and their family. All of these factors are complicated and personal, and Governor Gianforte's opinion does not need to be one of those factors. Doctors and medical professionals like us will be voting yes on CI 128 on behalf of ourselves, our patients, our families, and our whole state. We urge you to join us. Together, we can protect our rights and keep Montanans, not government, in charge of private medical decisions for generations to come. Thank you.
Thank you so much, Dr. Taylor, Dr. Guggenheim, and Dr. Downey. We now have some time for questions. If you have a question for one or any or all of the physicians, the best way to ask that is to either use the Q&A function or the chat function, and I can help sort through the questions that way. So we will allow a few moments for folks to be able to type those questions. As we wait too, I will say that we have been recording this. So if you would like a copy of the recording, please, you can send me a chat in the chat box or an email where you RSVP'd, and I am happy to send the recording to you after the call is concluded. Not seeing any questions yet, but I know that sometimes it takes a minute to type, so we will allow a few more moments for folks. Great. Well, doctors, oh, here we go. Here's a question in the Q&A from Blair. What do you all hear from practitioners in other states who are dealing with the restrictions? That's for whomever wishes to answer.
Happy to answer. If anybody else would like to answer, they certainly can too. I have a close friend from medical school who's practicing in Idaho right now, and she has said, I would be terrified to be pregnant in the state of Idaho right now. I have another colleague and good friend who just finished a reproductive fellowship after her OB/GYN residency in Utah, who is taking care of many of the patients that are getting transferred out of Idaho. And she thinks that it is gross and inappropriate that patients are not being taken care of in their hometowns by their local providers, risking complications by being forced to travel and delay care to travel to Utah, sometimes from as far as North Idaho, to get the care that.
Just to jump on to Dr. Downey's comment, I was able to, as part of my training, I was able to provide some pregnancy-related care in North Carolina, which is currently taking care of a lot of patients from Tennessee, Georgia, other surrounding states that have abortion restrictions. And I met with a lot of the patients that are seeking care outside of the state of their residence because of the bans. And it leads to delays in care. It's higher risk because they're not able to get care in the location they are, and it creates barriers, especially for the poorest people in the state, making it a lot more challenging for people to make those safe decisions around pregnancy and starting a family in their lives because it's so much harder to get the cares that they need in the state that they're in.
Thank you both. Question from Shaylee. I understand that the American College of Obstetricians and Gynecologists opposes using viability in abortion policy. Do you have any concerns with that term being used in this initiative? Dr. Taylor, do you want to take that one?
Sure. I wasn't aware that the ACOG doesn't support that language. I think that it's been very clear for quite some time where that line is, and I think for the purposes of this initiative, we've had decades of experience with that 24-week cutoff being a viability, and that's something that's outlined pretty clearly in the 1999 Armstrong ruling in the state of Montana. That has been a standard for quite some time. I think that it is a very good guideline for where we're at currently with medical reproductive technology, and it will serve us for many years to come. I think as medical reproductive technology advances, we're going to have to continue to adjust to what that means. But that's a question for decades from now, not for today.
Thank you, and thank you for the question. A question from Carly. What challenges are you seeing patients experiencing what challenges are you seeing patients experience accessing abortion or pregnancy care as it currently stands with protections via Armstrong?
I think right now, I'm fortunate enough to practice in a center where we have very good access to abortion care. There are certain cases where where people have later pregnancy problems that need to be sent out of state, but for the most part in my community, it's very accessible. The problem with Armstrong is it depends on a couple of Supreme Court justices. So with all of the different elections that are happening every year, if these laws that continue to get passed, like we saw in the 2023 legislative session, were to continue being made, which we expect they will be by a supermajority of Republican Senate and House. If the Supreme Court shifts at all, it's a very thin margin that is maintaining Armstrong. And I think we'll see exactly what we saw in the US Supreme Court, where they overturn 50 years of precedent despite to rule with the judicial legislation to change the will of the people. So I think that's why this initiative is so important.
I can jump onto that as well. You know, I am actually in a more rural practice than you would expect for one of the larger towns in Montana. In Butte, our patients, it never ceases to shock me how underserved and how significant poverty affects their healthcare. And currently we have 3 delivering physicians and 2 delivering midwives in town, you know, for a fairly large population center. The hospital is already struggling to keep delivering providers around and local. If anybody does have complex care that they need, so maternal fetal medicine is the subspecialty we use. The closest is Missoula, which doesn't sound far by, you know, the grand scheme of Montana, but I have patients who don't have cars to come to appointments and have to walk a couple miles just to come see me in clinic. And so when there is fear around who can provide what care or what care is accessible, that's a huge barrier. Poverty is a huge barrier, and I know that Butte is not the only town in Montana that is struggling with poverty issues. And then also there's a misinformation issue. So I have patients who come in and they don't think that they can ask me about abortion care because I work at a federally qualified health center where we don't provide abortions due to our federal funding, but I'm allowed to refer them and discuss it with them. And there's just a lot of misinformation. I think that that's probably one of the biggest barriers to care is telling patients, yes, you do have the right to make your own reproductive decisions and you can talk to me about it. So those are some of the big barriers that I see with my patients.
Thank you both. Thanks for that question. We have a couple questions about some of the claims from the opposition. The first one is from Blair. What would you all say about the notion coming from some politicians who say measures like CI 128 could lead to abortions occurring, quote, moments before birth, much less those who claim abortion after birth? Does that occur in reality? And if so, why would something like that occur? Dr. Taylor, do you want to take that one first?
Sure. No, that's not happening in Montana. We have a very clear guideline of viability, which most medical professionals define as 24 weeks. And there is no clinic in Montana that goes over 22 weeks to give a very good cushion to that viability timeline to not get anywhere near the gray line. There's nowhere in Montana. There's not even a doctor that's practicing in Montana that feels comfortable with abortion up to the date of birth. That's not happening. This is another fear-mongering misinformation provided by the opposition to continue to scare people into voting against this initiative. And we will continue to fight back against that misinformation. In the very rare case of what we would call a third trimester abortion, those are done out of state, and they are done in very special situations with significant consideration given to all of the details surrounding the case. And often it is, in almost every case, it is a imminent threat to the life of the mother or baby in that situation. And that's not a thing that is happening in Montana. Oh, Dr. Kuhnheim.
Just to add to that, I actually have a copy, not of what's on the ballot, but the actual constitutional amendment as it would go in our Constitution. And it says very clearly, the government may regulate the provision of abortion care after fetal viability. So as Dr. Taylor just said, at 23, 24 weeks, I mean, when at the point that the child could survive outside the uterus without extraordinarily means to support it, like a ventilator, that the government then may have some regulation. It just won't happen. That's not how doctors function.
Thank you both. We have a couple more questions about some opposition claims. Another question from Shaylee. Some opponents say the initiative would leave too much open to interpretation, like what is medically indicated, up to healthcare providers. How would you respond to that concern?
I would say I don't think that that's a concern. I think that that's appropriate. As Dr. Guggenheim, stated, these pregnancy complications are very complicated, and there are not black and white answers. There, so much of it, the patient's values need to be a part of the decision, along with considering medical complications. And so allowing for medical necessity is not only important, but it's critical for the decisions to be made appropriately for patients.
I think venturing to get any more specific than that brings Governor Gianforte back into the exam room, right? Like we don't need politicians deciding what is a good enough reason. That is between a patient and their doctor and their God or their local church leader. That's totally, they can consult with whomever they want, but they don't need the politicians don't need to insert themselves.
Thank you. And a question from Justin, another argument he's seen against CI 128 in the voters information pamphlet says that the state of Montana could not require a safe medical setting for abortions or allow women to sue for a, quote, botched abortion that they are harmed from. Would you be able to counter that argument from a medical practitioner standpoint? Dr. Taylor, did you want to take that?
Yeah, I saw that in the voter information pamphlet too, and I just had to laugh because there's nothing in this amendment that would say anything about the regulation of who is an abortion provider and what are the requirements and credentials to be an abortion provider, right? That will remain, that power has always been and will always continue to be with the credentialing bodies of the state medical board and the state legislature, who has a role in deciding who's qualified to play those roles. And this has already been kind of arbitrated in the judicial system in Montana recently. And it's a ridiculous, bogus claim that tries to fearmonger that we're just going to have unregulated people calling themselves doctors doing abortions wherever. And that's not going to happen, as it already isn't.
Thank you. Another question from Justin. Do minors wanting an abortion need parental permission? Again, in the voters pamphlet, the opposition states the amendment would allow anyone to take young women to get an abortion. Dr. Taylor, did you want to take that one as well?
Yeah. CI 128 does not change parental rights. If anything, it strengthens parents' ability to help their children navigate the challenging or scary situations without having to worry about what the legislature has to say about it. yeah, there's already great protections in place to make sure that we cannot provide care to a minor without parental involvement, right? And it is essential that we continue to support people in these really challenging situations where people that are not of the age of consent are getting pregnant.
And I guess if you just think about that, I mean, you'd have to think that a person able to provide an abortion, a trained healthcare professional, would allow some nefarious person to bring a young woman in and, without asking any questions or without referring to the parents. It just doesn't make sense at all. That's not how health professionals, that's not how physicians and others behave. And I actually sat on our state medical board for about 8 years, and I can attest to the fact that things like that just wouldn't be allowed to happen.
Thank you both. And thank you all for the questions. I am not seeing any other questions. If after we conclude you have any follow-up questions, or like I said, would like a copy of the recording, please send me an email at annika@committeetoprotect.org. But otherwise, I want to thank all of the media who were able to join today. I know it's a really busy time, so we appreciate you being here to hear from these physicians. And thank you so much, Dr. Guggenheim, Dr. Downey, and Dr. Taylor for your time and sharing your advocacy on behalf of CI 128. We appreciate it.
Thank you all.
Thank you.
Thanks, everyone. Have a good rest of the day.
Thank you, everybody.